I'm here with Dr. Elizabeth Douglass, and we're interviewing her today. So, my first question is, what is your profession and what kind of work do you do on a daily basis?
So I am an adult infectious disease physician, and I'm also an internist. And on a daily basis, I supervise the internal medicine residents, and I take care of patients with complex infectious diseases at Del Seaton Medical Center.
All right. How did you come into this field of work, and what made you want to do it?
Well, I decided to go to medical school, and then I did a field study on infectious diarrhea in Mexico, and I found it to be really interesting and really enjoyed the people I was working with, so I decided to be an infectious disease specialist. And I really am interested in global health, and I really enjoy internal medicine, so infectious disease was really perfect for that area.
When did you decide that you wanted to go to medical school?
I decided I wanted to go to medical school when I was a sophomore in high school.
Wow. Any reason, or just?
I had a cousin that I really liked that was a biochemist. So when I was a little girl, I used to say I was a biochemist, and everybody was like, whatever, what's that? PhD in biochemistry. And then one professor in high school said, why don't you go to medical school? And I was like, well, that sounds interesting. There was really no particular reason, no story of illness. And then I walked out of the classroom and met with one of my friends. I said, I think I'm going to be a doctor. I'm going to go to medical school. And she's like, you're never going to get in. And that stuck with me. And I said, I will go to medical school.
Oh, but here you are. How many years have you been working in this profession?
I've been since 1995.
Wow. So have you always specialized in infectious disease, or did you, like when you got started, did you kind of jump around and try different things?
No, I had to do a residency in internal medicine. So I did 3 years of internal medicine residency, and then I did a year of chief medical residency. But then I already knew I was going to do a fellowship in infectious disease, and I really didn't work in infectious disease. I just thought the topic seemed like it would fit, and I wanted to do a specialty.
Yeah.
That's how I picked infectious disease.
Okay, awesome. So did you ever change your major in college? Or you said you knew by sophomore year, so did you ever doubt what you were doing? Or?
Oh yeah, when I came and started pre-med at UT and started doing those classes, I was like, wow, this is really tough. This is hard. It was super competitive. I didn't start out with the best GPA, and I doubted and almost quit because of that. And then somebody asked me, well, what else do you want to do? And I was like, well, I don't know. And so I stuck with it. And, just like all freshmen, it's very overwhelming. But I was a biology major. And if I shouldn't say that on this biology interview, but I love that people are picking various things now, pre-medical, not only biology, chemistry, liberal arts, but I stuck with biology, went straight to medical school, and then just kept going.
So you went to undergraduate school here?
I went to undergrad here.
And then where did you go to
And then I went
school?
UT in Houston.
Okay. And what classes in your undergraduate education were the most influential for you, would you say? Do you remember any that were particularly inspiring, or?
I really enjoyed zoology. I took that. I think that was one of the enjoyable classes. I really enjoyed sociology as well. I found that really interesting. Those didn't make me want to go to medical school. Like, to be honest, I had just determined I was going to do medical school. Took my pre-med classes, my classes to get my bachelor's in biology, and then applied to medical school. It went by in a flash.
What did you think about your undergraduate biology course?
It was interesting. It was good. In fact, I'm not going to say professor, but the other day I ran into a patient and I said, by chance did you teach biology? And she was my biology teacher.
Oh,
but
wow.
They were very interesting. And
That's funny.
I loved organic chemistry.
Okay.
I really liked, and my professor was very inspiring, enjoyed it a lot.
Yeah.
Didn't want to be a chemist, but I really enjoyed that.
Yeah.
What I did a lot when I was an undergrad, what inspired me to continue in medical school, is I volunteered a lot. I almost spent lots of my weekends at what, was the old Brackenridge Hospital. And in my summers, I have family in South America, and I spent most of my summers volunteering. So I was always seeing that aspect to make sure.
And doing the hands-on
that
work.
was really special. Like, I worked in the emergency room, and I didn't get to do a lot. I used to be the blood runner. I'd go get the blood for the trauma cases, and I think that really kept me
But you're still
going.
up in the action, yeah.
Yeah.
That's
fun.
great.
That's what I highly advise for people. Because we all can say I'm pre-med, but until you start really being involved in that area, you're not sure.
Yeah. Awesome.
Have you conducted any research in your field, and if so, what was it?
I did some research when I was a fellow, when I was specializing, and it was involving Cryptosporidium, which are parasites, and the effects that the complement system has on these parasites. We were all required to do almost a year of research, but I have to say, bench research, working in the lab, was not my favorite. I've always just really enjoyed taking care of patients, and I've been involved in clinical trials with infectious diarrhea primarily, and published papers. But my favorite thing is research is more to see a unique case. I find a case that's never been written about and review the literature and kind of describe it. That's not really basic research. I've not done much of that.
What would you say is your most favorite part about your job?
It's twofold, and I think this plays into the biology. It really looks, the patients that have infectious diseases, you really look at you do microbiology, you understand immunology and physiology, and so these cases are complex. It depends on the type of patient you have, where they've been around the world, what they've been exposed to, and it's like a lot like detective work. You get to see an intriguing case, something people can't figure out, and then you look at all the factors and you come up with your hypothesis. Then you get to prove your hypothesis in infectious disease, because by cultures and biopsies we really get to the answer. And for the most part, people are cured, so it's really rewarding.
Could you think of one of your most memorable cases? Maybe share a little information about it.
What am I? That's a question in medical school interview. Gosh, I have so many great cases.
It's hard to choose.
It really is, but I can talk to, just last month I had 3 cases of really invasive, so what that means is fungal infections that are really eroding through different parts. And one patient was a patient that had invasive mucormycosis, so he had a fungus that went into his sinus, into his brain, and it really has a high death rate, and it was very rewarding. We reviewed the literature. There's some new medications that came out, treated him aggressively, and he's gotten much better. I can tell you 5 cases, and they're rewarding because these patients have horrible infections. Another viral brain infection. I just had a young man who had bled into his brain from the virus, the virus and the immune system having this kind of war in the brain. It's called encephalitis. And he was very sick, and we had to, again, review. You study all the literature, you call experts around the world, and we did a little bit of a novel treatment in him, and he's now in rehabilitation and doing great, progressing every day. So those are, I go on and on. I have so many cases. It's just it's very rewarding.
While you were in medical school, was the ratio of men to women significant in any way? Did you notice there was more men or more women while you were in
When I was in medical school, there was a little bit more men, but it was soon getting to the point where it was 50-50.
Okay.
Where I think now it's switching more, where we've got more women than men,
Really? Okay. That's interesting.
I think. But I don't know exactly our medical school class.
It's weird that you say that because I feel like I know a lot of friends of mine, girls, who are on pre-med
Pre-med,
tracks,
yeah.
but I cannot tell you really like a single guy friend I have who's pre-med, all like business.
Mm-hmm.
Yeah, I think it's 50. Now, the school may be doing a good job, the medical school, to kind of try to get that, but I don't think we're the minority. Now, in
When you were
certain
in school,
specialties, we are. Surgery.
Okay.
I heard a really interesting talk on unconscious bias, and they tell a story about a boy and his dad are in a car accident, and the dad passes away, and the boy is really sick, and they rush him to a hospital, and the surgeon sees him and says, "I'm sorry, I can't operate on this boy." And they immediately stop and say, "Why is that?" "Well, the surgeon is the mother." But nobody in that room can think that the surgeon is the mother. You know, so in surgery, we definitely have more predominant orthopedic surgery, it's more men.
Okay.
Do you perform surgeries or do you
No.
just diagnose?
I just diagnose.
conditions.
Yeah, I don't do any procedures. Keep my hands clean.
How long are patients in the hospital usually when you have, like when a case comes in?
It depends. It could be from 3 days to months, depending. The patient with that bad sinus, brain, fungal infection was there 2 months.
Was it a challenge to overcome like deaths within your profession? Like obviously
Oh, yes.
infectious diseases are very serious.
It's hard to have deaths, especially when when they're unexpected, of course. But it's always hard to have deaths. It definitely is. It's hard, and it doesn't necessarily get better over time.
How have you found ways to like cope with that?
I come to some inner peace, and some patients that we've done everything that we can, communicating well with all the team members. Communication is the essential thing to work with your nurses, the palliative care folks, the family, to really just communicate, and you do your best, and some patients can't make it because of, especially I worked at MD Anderson, so lost a lot of patients to infections with cancer. And that, of course, is hard, especially when they're young. And really, when you think about infectious disease, most cancer patients, many of them, they die of infections. And so it really is the end of many chronic illnesses or infections. So it is hard. But
What about separating, like when you go to work and then come home, like separating yourself from work, and like being able to like detach yourself from what's going on at work than with like in comparison to being at home?
I think I can detach, but I have married to a physician, and I don't talk about my cases, but allow myself to communicate that I'm sad. I'm not that stoic person that comes home and doesn't just completely is not going to say, "Oh, that was really rough, I lost a patient today."
Mm-hmm.
So, and I think that's kept it healthy for me.
What advice do you have for us as we go on through the next few years of undergraduate school here at UT or in general?
I think my advice, I have many. One would be to just look ahead. Don't, yes, you want to live day by day. I know all of you guys will do the best you can to get the best grades, but look at what your dream is and realize that if you make a B in chemistry or a B in biology, that doesn't mean you can't be what you want to be, because every kid at UT, you guys will be able to be a physician, nurse practitioner, nurse if you want to. it's a matter of just saying, I'm going to do this, and I'm going to get in. And if I don't get in the first time, I'll do it, That being said, it's important to have some kind of experience, get involved in the medical community somehow, to know that that's really what you want to do, because you're going to put so many years in it. The third thing that is really important and exciting is that young people are really looking at health disparities and ideas that we can have to improve, because we have huge health disparities, even in Austin. And so I think getting involved in that is really important. It makes you feel good, coming up with some ideas. I often find that the best innovative ideas are coming from the medical students, that are really thinking outside of the box and saying, why don't we do this or that? So those would be my three, but number one, just go with your dream. If you're interested in it, keep going and don't get discouraged.
After watching the interview with Dr. Douglass, it really stuck out to me the emphasis she put on determination. She mentioned that she knew she was going to medical school by her sophomore year in high school. Her freshman year of college, she mentioned that her course load was overwhelming and she doubted her plan, but nonetheless, she stuck with it. She said that something that inspired her to stay on her pre-med track was volunteering and getting hands-on experience, and that prepared her to handle real situations later in her career. Overall, I think Dr. Douglass gave great advice. See the big picture and don't allow small obstacles to come in your way of your goal, but also stay determined and passionate about what you are doing in the day-to-day.